First of all, our three panelists to take a seat here next to me. First of all, we have the CEO of Comunicare, Alfred Attipoe. Then we have Professor Benoit Macq from EONIX, administrator and member of the scientific committee. And we have Raoul Ullens, who is the co-founder and CTO of Gratiago. And this panel discussion will be moderated by Denis Bornau from Agoria.
Thank you, Valérie. Thank you, dear panelists. Security. So, we will talk about blockchain in a very sensitive and regulated sector, which is healthcare, and how entrepreneurs are taking blockchain technologies and use it for the benefit of this sector. So, first question will be for Professor Macq. You are here representing one of the spin-off of the university EONIX with a specific project, which is Decisus. Smart contracts for out-of-hospital care. My question is, how does blockchain enable fair management of the care journeys?
Okay, so the idea that we have developed with EONIX and with people in my lab, but also from the legal department, and which led to a new startup, which name is Decisus, is the problem of how care trajectory can be handled outside the hospital. So the hospital is generally responsible for caring inside the hospital, but becomes more and more responsible of the trajectory outside the hospital. The trajectory of outside the hospital needs to create an open marketplace where the therapist outside the hospital can provide cares and can make offers in an equitable way. And there, to create this trajectory with several intervenants, for example, speech-language therapists, physiotherapists, specialized nurse, how can they handle in an equitable way patient trajectory outside the hospital? So the idea was to create a private blockchain system with smart contracts to enable several providers to enter in the ecosystem and to create a community around this hospital. And so I liked very much the talk of Dimitrios this morning, speaking about the third pillar. And in fact, a care system is a complex ecosystem where you need provider, you need the patient, you need trajectory. Each step in the trajectory can be seen as a token, and the smart contract allows to ensure a fair reimbursement and an efficient care of the trajectory of the patient. And that's the reason why EONIX entered in the business of blockchain and find it a very nice and very efficient solution. At this stage, Decisus is not yet integrating all the technological pieces, but we can discuss later about the technology itself. For example, we had developed some special mechanism which help elderly people to be eased with what is happening, because the visibility of the technology is sometimes complicated. So we made simple things with sheet of papers to solve specific problem, but I will explain that later.
And is it more a question of efficiency or a question of trust in a really complex flow?
Trust, and one other word which was very important for us is equity. Equity in the provider. If you have a very young nurse entering the system, you have the old nurse who knows every doctor, how to make the system open, which allows new entrants to provide new ideas, new way of caring in the system. So the openness and equity was even more important than trust in the things that we have explored with the use of blockchain. Yeah.
Thank you, Professor. Mr. Attipoe, you are the CEO of Comunicare. Comunicare is a platform that aggregates information from the patient and collects his or her data to make it available for the healthcare team.
Yeah.
Okay? What has been your experience in developing the development of blockchain solution, and what are the blocking factors in the real life you had during the deployment?
Thank you. Comunicare is the first initiative that we carried on several years ago, and it's a spin-off of University of Liège. Our objective was to develop or propose a solution that will enable patients to be followed up in two contexts. The first is in the context of chronic care. We started in oncology, which is a domain where there is a huge need of follow-up for patients, and also in other contexts which are not chronic, like after discharge or from hospital, after surgery, after any kind of intensive care, for example. The objective is to propose or to give to the patient a lot of information about what happened to him, and also about the treatment and how to behave or how to support himself from home. And providing this tool, then he can report data from home to the caregivers. This data can be symptoms that he has, or the vital parameter that he is taking, depending on the disease. So we are talking about very sensitive information about the way the patient feels from home. And in this application, we already, at the beginning, wanted to have the, all kind of people around the patient to be involved, particularly what is called the informal caregiver. It means the relative of the patient, because at home, sometimes there is the children of a patient, the spouse, or any kind of relative that want to be part of the journey and want to have access to this data that the patient is receiving or is reporting. So in our application, we already have the classic, we have already implemented this kind of methodology to share the data based on traditional technology. So we have an authorization mechanism that enables the patient to share the data with the relatives. There is also an emerging need where, because patients report data, this data can also be interesting for clinical studies. So there are a lot of, not a lot, but more and more initiatives to ask data from patients so that they can be shared. So we feel like it's necessary, it's important for patients to share those data, but it has to be done in such a way that we guarantee the transparency of the consent that the patient gives, the traceability of that consent, and also because today we do that in our application, we want to use something that will be decentralized so that everybody can monitor and can watch it. So that's why we first go to see what we can do with the blockchain. So in the blockchain, we experiment different network. We study most of them. We implemented a few of them to see how they can enable us to implement smart contracts so that we can store the consent of patients in those smart contracts so that they can be available to the third party that will have access to the patient data, and enable this also to be transparent and traceable along the life of the patient. Technology is not a problem because we succeed in implementing different networks. I can name Ethereum, for example, and we also were the first that implemented the testnet of WorldChain, the Wallonia blockchain. The issue that we have to bring this technology to the real life is more related to different factors. For example, the cost of transaction. It's something that is not obvious when you use the blockchain in the financial world because there is a kind of monetization that is included already. But in the healthcare, can you imagine that the patient is willing to pay up to $50 or 15 euros to sign a contract in the blockchain? That's something that is not feasible at a first sight like this. Also, there is an issue about the usability. Today, our patients that we have in our application, they are more or less above 60. So we already have this difficulty to use an app to follow up their own health. So adding on top of that a new technology that will be very difficult for them to implement. You know that in Belgium we have, for example, It's Me, that's very easy used today to access different services. It's Me is very difficult to implement at the first sight. So blockchain is a level above that for such patients. So in terms of usability, it's something that is, we need to make some work on top of that to make it usable. And lastly is the legal framework, because today we can easily manage such system to share data. I was referring at sensible data, so we have to comply to different regulations, especially GDPR, for our system to be accepted. So if we move to the blockchain, what is our responsibility if something goes wrong? And what are the legal framework that will be in place to allow us to operate safely? So this all of the issue that we need to solve before going into a way that we operate very in real life the system that we have developed.
And if you have to make a classification of this issue, you talk about legal, cost, and usability. What is the first one you think we have to work in?
The first one is the cost.
The cost.
The transaction cost, which is heavy. So today we haven't put in production such a system because upfront there is a cost that is needed to operate it.
And would it be possible if there was a country blockchain for government use to add your use case on the list on what we can do on blockchain?
Yes, exactly. So we welcome this kind of initiatives. As you know, Denise, we work on the World Chain initiative. So that's a kind of initiative that will make it successful implementation of blockchain outside the financial world, I would say.
Thank you, Raoul. Gratiago, nice pronunciation. Yeah, Gratiago. It's an e-coaching solution to accompany patients in the treatment. What benefits can tokenization bring to the healthcare system? And why blockchain as technology? Why not using a simple database?
So I'll quickly set the scene here. I don't know if my mic is working.
Mic?
Can you hear me?
Just again?
I'll try again.
Peut-être l'interrupteur.
No,
Can we have a mobile mic, maybe? Yep. Sorry for that. It's not the first Murphy law we occurred this morning.
Here we go. Can you hear me?
Yes, thank you.
So I'll quickly set the scene here in terms of Gratiago and what we're doing. One of the big issues we're tackling is that there's a lack of adherence or compliance in the healthcare sector. That means that a lot of patients don't take their treatment properly, either because they forget, or they're lazy, or they're wary of side effects. And this has massive costs on our society. In Belgium, it's already 3.2 billion per year. And what we're developing is Gratiago is an app that accompanies these patients, first through a method, at the moment of treatment intake to make them more aware of the benefits of their treatment. And then we leverage tokenization, so we encourage them through points, and they accumulate points, which are effectively tokens. And as they accumulate points, they can exchange them against different sorts of services and products. So we're doing this with the Mutualité Chrétienne, who's one of our main partners today. And to get back to your question, Denis, so tokenization enables some very important advantages. First, you can have a normal accumulation of points without a token, without the blockchain, which is like Brussels Airlines, where you have miles. But these miles, you can only use them inside your app. So Brussels Airlines is going to control where you use them and how much you can spend. Whereas if we go through a token, we can first of all create a market for this token. So people will be able to use this token in a local pharmacy, maybe at a massage place or at the gym. So we're going to create a whole market for this. Secondly, which is very interesting, is blockchain and smart contracts enable a lot of different services that can build on top of this. And this is not possible outside blockchain. And when I say services, an example of that would be to enable users and patients to vote on where they want the app to develop itself. So we think that's very important, but also users to accumulate more points and believe that the value of these points is going to increase because there's a market for that. So all in all, and then the third point, sorry, is that blockchain is a very secure database compared to a lot of existing databases. So if you accumulate a lot of points on your local server and it's not on the blockchain, there's a higher risk of it being hacked. And if we talk about a lot of value, well, this has some serious consequences. So all in all, if I have to summarize, we really want to use blockchain and tokenization to encourage the patient to be more healthy, to be more trusting of their treatment, and at the end, this is going to have an impact on society. And sorry, the last point is that it creates a win-win-win, actually. So first of all, the patient is going to get a lot of value from becoming more adherent. So it's not only that the mutualité or the state is going to make savings, but part of these savings are going to go back to the patient who earns a certain amount of value. Then the state is going to make savings because ideally, patients become more and more compliant, so they're less hospitalized, so there's a smaller waste of money. And this is essential in our current state because budgets are becoming smaller and smaller, so we need to find such solutions. But lastly, also different partners, such as pharma labs, they also gain money and value from having more compliant patients and being able to, besides just providing a drug, also providing a service of support to the patient.
And currently, you are using what type of blockchain, a private or public one?
It's a public blockchain if you want to create that token and create a whole market. At this point, we're having different stages, so we don't think it's a good idea to go full on the blockchain. We first want to build sort of a mild system, which we're busy building, and then next we'll go on layer 2s, so Ethereum-related layer 2s, such as Polygon or Starkware.
And if I understand well, you are making, for you, tokenization is used to make gamification, a little bit, and this gamification is made to, for the cure. Is it possible to reverse, to use this gamification to make not the cure, but to afford that someone be healed, and so to have it before to be healed?
In terms of prevention,
prevention, yes.
We haven't explored prevention yet. So what we do is we encourage people to take their treatment more properly, and then it's their relationship to the treatment that is going to be improved. So we don't pretend to be curing, but we help them in that way. And we're also exploring other fields indeed, such as prevention, addictions as well. So, sorry, there's a lot of applications of this.
Question for all of you, for all the solutions you have. How do you render the data confidentially, as blockchain is about having everything public, I would say? Or do you manage that in your solution? Alfred?
Yeah. So Comunicare is by design, privacy by design, meaning that all our software handle the security of the data. So for the blockchain, we only expose the smart contract, so something that can be public. We don't send any kind of data, sensitive data or personal data into the blockchain. So we make sure that only the smart contract, that's something that we want to be public, is shared in the blockchain.
Raoul?
So in our case, first of all, we are on our own databases, which are confidential and anonymized. But then once we'll go on the blockchain, we'll rely on decentralized identity solutions. So these are solutions that create a token for each person, and they are specialized actually in anonymizing what's behind that token.
And Professor Macq?
Yeah, so the main goal of Decidios and the solution that we developed is to create an open marketplace to make known people which can provide service in the care trajectory. So this thing has to be made public. And then the trajectory itself is based on secret tokens that are secured by some cryptographic means. We rely also on technology which is developed in Réseau Santé Wallon, where the security layer is very well managed. And so our concern was more to create a community around the hospital, relying on existing tools for securing that data for the patient and securing the trajectory. There are existing tools, but our concern was more to create the ecosystem around the hospital. If I may add two things, the things that I heard, I think two things very important were about usability, accessibility of the technology, and business model behind it. Maybe I was clear enough, but in the hospital, the reimbursement will be based on pathology, not anymore on acts. So if you have a pathology, the hospital will receive a lump sum from the pathology. So it's
hospital of the future, not the current.
The future,
right?
And it appears. So there are a new legal framework. And there, the blockchain and creating an ecosystem is important, because the hospital, if it can organize the care trajectory efficiently by relying on the local ecosystem, they will gain money from it, because the care will be done with less cost. And so I think in the field of medicine, generally people say that you need three main factors to be successful: economy, quality, and accessibility. And the solution that we were searching was something which allows hospitals to gain more money from the reimbursement, to ensure quality because they are an open ecosystem where new provider can enter easily, and the accessibility, the idea was that this trajectory of care was organized through token, digital token, but we also had paper token for elderly people, for people who are not digital enough. We created paper token which were fully secured by watermarking technology, by some special technology based on AI. That's part of the reason why I was there. And so we try to succeed economy where the solution allows to gain money, to save money from Inami. Quality, because you are more open, you have better provider, there is a competition in the provider. And accessibility, ease of reading for the patient, and he understands well how the system can handle this new way of caring. But for the first point, we need to see a transformation. Where there is a need of transformation, there we can plug the technology in. And I think I fully support your point. And the cost is really factor one. And in your case, probably the driver was the data that you can grab for pharmaceutical companies, for medication tests, and that was your driver. And the driver in our case is more the fact that there is a move from reimbursement per act through reimbursement per pathology, and then the people have to organize the care trajectory, which allows to have the lower cost for a given pathology. Yeah, that's what was the point. Yeah.
You took my last question, I would say, because you were talking about the people were less digital. if we go with such solution, you have a solution for you, Alfred, and for you, Raoul. Do you have solution for people less digital to be in the mood of using a solution like the one you have?
So we do plan on organizing workshops because it's also about educating the patient and sensitizing them. But the reality is we're also developing an app where we're a bit comforted is that 80% of Belgians have a smartphone today, and it's projected to be 92% by 2025. But we're very much aware that we're still leaving an 8% out of it. So that's we're going to do through partnerships with patient houses and hospitals, and organize proper workshops for people to come, and with the Mutualité Chrétienne, of course.
Yeah, on our side, we also did the design of our application using doing a focus group with patients. But here, for the blockchain, the whole subject for us is to be in the situation where we have access to tools that are available. For example, if you see on the market of mobile wallets for blockchain, there are tons of them, and we won't be in a position as a startup or a small company to build our standard in that domain. So we need to collaborate with other companies that are building such tools so that we can provide them into our application for our patients, because we want to work in our domain, which is building application for health, not building application for blockchain.
Yes, other company collaboration or collaboration with the government. Currently, there is a lot of discussion about those wallets. There is project at the Belgium level. We have also project at the European level. Are you already in contact with actors like that could collaborate with you?
Not yet. I think today was the opportunity for me to network and see who is doing what. And
this afternoon we have also people from European projects that could be used also to bring your solution to, I would say, a broader public, because it's there a solution that is synced for the whole Europe and not only for one country. But
yeah, exactly.
the projects which are currently also made in Belgium are working with those projects in Europe. So it's really interesting to have a discussion with the people that you will have this afternoon as speaker to go further.
Okay.
I thank you very much, and I try to reduce a little bit time. Sorry for the delay of this morning. Thank you very much. Thank you.
Thank you.
See you.